Patrick McGorry, one of Australia's most recognised psychiatrists and mental health advocates, is calling for a major shake-up to the National Disability Insurance Scheme. Professor McGorry wants to see mental health split from the scheme to make it more sustainable and better suit Australians living with a psychosocial disability. He joins me live now. Thanks very much for your time. So just explain briefly, first of all, why this split would be a good idea, in particular for the people receiving treatment.
Well, thank you. It doesn't necessarily have to be a total split, but it needs a massive rethink. Just throw a few facts into the mix here. Mental illness is the #1 cause of disability in Australia. It's the #1 chronic disease in Australia, and yet it's really an afterthought in the NDIS, and it hasn't. The NDIS was designed for people with severe physical disability, which is permanent and is not going to improve. And it's doing a good job for those people, as I understand it. We're certainly not wanting to interfere with that, although obviously it does need to be reviewed and looked at because of the costs blowout, I guess. But on the mental health side, people with mental illness, there are 5 million Australians every year with mental ill health. There are about 700,000 or 800,000 Australians with serious disabling mental illness, and only 50,000 of them are allowed into the NDIS. And even if they get in, the sort of things the NDIS funds are not really fit for purpose. It doesn't meet their needs, their main needs. And the other problem is that it disenfranchises young people who bear the main burden of mental illness, because you have to show and prove you've got a fixed and permanent disability, which young people do not necessarily have at that stage of the illness. Mental illness is fundamentally different from physical illness.
That's the big word, I suppose, isn't it? Permanent. Mental illness, mental health can oscillate a lot for people. If it's not permanent, you're not getting into the NDIS. What's happening to you? You're slipping through the cracks, you're having to seek another service?
Well, there aren't other services because the health, and that's the other paradox. We're underinvesting so much in the health care of people with mental illness. They can't even get to see a psychiatrist or a multidisciplinary team for these more complex illnesses. They're locked out of equitable health care for their main needs, and at the same time the NDIS for a small percentage of them is providing things they don't necessarily really need, like having their lawns mowed or having a cleaner once a week. I mean, at the same time as they can't actually get proper health care. So it's just a mismatch between the model and the needs of the people.
Yeah, a lot of people don't know as well, it was a last-minute inclusion within the NDIS, I'm sure with the best of intentions, but as you point out, that permanent word is the key one. So a new system, whether it be within or outside of the NDIS, would obviously have different qualifications. And the crucial thing, I suppose, as well, if it's a lower bar for entry, intervention is so important in mental health. The earlier you can start treating people, the different outcomes you get, and that includes for children. So that would be... If the word permanent is out of there, suddenly you open it up to a lot more people to be able to access.
Well, it's much more hopeful, because with mental illness, especially in teenagers and young adults, not so much children, but to some extent children, you get a return on investment. We know that if you invest in not just a health focus, but a social focus across that age range, you get a very substantial return on investment. So the black hole problem about the NDIS and the cost escalations can be partly addressed by having a much more effective set of interventions. So it's not just access, the access criteria, it's actually the types of interventions that are covered within the new model.
So that's the other question about sustainability. A lot of questions right now about the NDIS, how do we make it sustainable? It's clearly costing a lot more than anticipated. When you talk about that being the benefit, is that down the track? Would this perhaps cost more initially as more people are able to get appropriate treatment, but have a clear dividend in all sorts of ways down the track?
Not necessarily. We see these returns on investment within the first year of more effective early intervention strategies, but it does involve a blend of health and social interventions, because as I say, I mean, this split between health care for the mentally ill on the one hand and the social services sort of support through the NDIS on the other, that's not helping anyone. We need a holistic, integrated model for people with emerging mental illness.
All right. Well, look, there's a lot of ideas being put out there. This is a particularly interesting one, and as you say, so many people not able to get the right access and money being spent in not the best areas, which people in Canberra, they're talking about it, so I'm sure they'll pick up this idea.
Yeah, well, luckily there is a review been announced by Minister Shorten, which is very welcome. We appreciate his willingness to do that, and he's appointed good people to conduct that review. So we're hopeful we'll get a change of direction, and it's actually a win-win for the government. They'll be able to get much better outcomes, and they'll actually save money in the process if they look at this in a different way.
And once you talk about saving money at the moment, governments will start to listen, if I may be so cynical. Professor McGorry, great to get your thoughts today. Thank you.